Thank you, Madam Speaker. I move that Bill number M214, intituled Firefighters Health Act, as amended, be concurred in at report stage. Madam Speaker, I'd like to take a moment to thank the members opposite on the Select Standing Committee for Private Members' Bills for jointly working towards amendments on this bill that not only strengthened the intent of it, but kept the integrity of the bill intact. Making adjustments to make the bill's timelines and consultation more workable for the government is proof that collaboration on both sides of the aisles is what this committee should be about. So sincerely, thank you. In summary, the committee took the advice of the submission presenters and made 4 amendments, 3 of which were repeated in other clauses. They also corrected an original drafting error and assigned the bill to the Ministry of Health. 2 of the main amendments were based on recommendations by stakeholders to add critical exposure data collection to help formulate future plans and to decrease the eligibility of forest firefighters from 10 years down to 5 years. Both recommendations were excellent pieces of input and were unanimously accepted by the committee. Another recommendation from the ministries impacted by this bill was to allow for a greater amount of time to formulate the plan, increasing from a 9-month timeline to 12 months. Again, another welcome recommendation unanimously accepted. The 4th amendment, also based on the recommendation from the Ministry of Public Safety and the Solicitor General, was to allow the ministries in charge of the Fire Safety Act, Workers' Compensation Act, and the Wildfire Act to choose whom it wishes to collaborate with for the purpose of creating the healthcare plan. This was a reasonable request, and it is how collaboration with the BCPFFA, BCGEU, and the Fire Chiefs of BC has already been working. Again, another amendment unanimously accepted. 2 amendments based on the recommendations of the government, 2 recommendations based on the recommendations of stakeholders, all enhancing the bill while keeping the integrity of the bill intact. I wish to recognize Todd Shearling, President of the BCPFFA, for his support and guidance during this past year, and to my local 4550 for their continued support of my community and advocacy for their health. This bill came from 7 years of advocacy from the BCPFFA and from the stories within my community. Although this process has taken 11 months to get here, the good work and impacts will be calculated for generations. Thank you for this opportunity.
Recognizing the member from Burnaby East.
Thank you, Honourable Speaker. I would like to start by thanking the firefighters, and I'd be remiss to not mention the 3rd anniversary of the passing of Ray Sawada, former NHL player and member of the Burnaby Firefighters who joined in 2017. Rest in power, Ray. Firefighters put their lives on the line every day to protect us all. Your courage and commitment do not go unnoticed, and we are deeply grateful for the sacrifices you and your families make. I also want to thank the member for Langley Walnut Grove and all the members of the committee for the time and care you've put into examining this important issue. And to everyone who participated in the process through written submissions or presentations, thank you for contributing to our democracy in such a meaningful way. Supporting the mental health and well-being of our frontline workers, including firefighters, has been a top priority for our government since 2017. Over the years, we've taken steps, important ones, to strengthen protections by expanding presumptive coverage and ensuring it reflects the realities firefighters are facing today. This includes broadening the definition of who's covered, moving beyond firefighters employed by local governments to include federal firefighters, such as those working on military bases in BC, provincial wildfire firefighters, that is a mouthful, firefighters employed by First Nations and Indigenous organizations, and fire investigators who are members of a fire brigade. We've also expanded the list of cancers recognized as occupational diseases and reduced the minimum cumulative employment periods for several cancers, including testicular, colorectal, and esophageal cancer. Most recently, we took a significant step forward by increasing the number of cancers covered under presumptive legislation from 18 to 26. This means British Columbia now has the most comprehensive firefighter cancer presumption protections in Canada. The addition of cancers such as skin cancer, mesothelioma, soft tissue sarcoma, and several respiratory-related cancers reflects evolving scientific understanding and ensures more firefighters can access timely support when they need it most. Importantly, these protections now extend to approximately 15,000 firefighters across the province, including career, volunteer, and wildland firefighters. For wildland firefighters, we've recognized the unique nature of their work by counting a single fire season as a full year of exposure for compensation purposes. Our work doesn't stop here. We are actively supporting efforts to improve data and research, including collaboration with Statistics Canada on the development of a national firefighter cancer registry. Together, we are building a stronger, more informed system, one that honors the service of firefighters and supports their health today and into the future. Thank you, Honourable Speaker.
Recognizing the member from Prince George, Mackenzie.
Thank you, Madam Speaker, for your guidance. This has certainly been a thoughtful and collaborative process and a new one for the legislature, but really with meaningful input from stakeholders across the province. And first and foremost, I want to thank the important feedback and submissions and presentations through this committee process by, first and foremost, the BC Professional Firefighters Association. Their dedication to the long-term health and safety of firefighters across the province is deeply appreciated. I also appreciate the dialogue at the provincial conference several weeks ago, and I know that Bill M214 remains one of their top priorities. I will sincerely thank the BCGU for their submission on behalf of wildland firefighters who do tremendous work in near impossible conditions to protect communities. Their input and input from the Office of the Fire Commissioner helped to strengthen this bill, including reducing the years of service requirement from 10 years to 5. Bill M214 is a focused and practical piece of legislation. The amendments made at committee have clarified certain clauses to respond to feedback from government and stakeholders, and that's why the timeline for government to table a health plan for firefighters has been extended from 9 months to a year. The Minister of Health has been confirmed as the minister responsible, and additional amendments include requirements for consultation to include ministers responsible for, of course, the Workers' Compensation Act, as we know, but also the Fire Safety Act and the Wildfire Act. The bill also now includes, the amended bill now also includes improved exposure data collection, which is something that the committee heard very, very loudly as a priority. These changes are measured and they're constructive. They move us towards better health screening for more firefighters and support a stronger evidence-based approach going forward. Ultimately, this bill will also help us all as legislators to look more long-term when it comes to cancer presumptions. Recent updates, I'll acknowledge, of course, the updates to the firefighters' occupational disease regulation. Those are very welcome. But the firefighters where I live in Prince George have certainly reminded me that there is much more work to do. Thank you for the time to speak, and really thank you to the member from Langley Walnut Grove and the entire Private Members Bill Committee for their work on this. Thank you, Madam Speaker.
Seeing no further speakers, I'll ask the member for Langley Walnut Grove to close the debate.
Thank you, Madam Speaker. Seeing that there's no further speakers on this matter, we will close debate.
Members, the question is that Bill number M214, Firefighters Health Act, be concurred in at report stage. Those in favour say aye. Aye. Those opposed say nay. Motion is carried. Honourable members, the House will now proceed to third reading of Bill number M214, Firefighters Health Act, recognizing the member for Langley Walnut Grove.
Thank you, Madam Speaker. I move third reading of Bill number M214. And then I will say something.
Continue.
This has been a surreal experience where creating legislation has the direct impact of the lives of British Columbians. With this bill passing, may we be able to prevent the early deaths of firefighters, while being an example to the rest of Canada leading the charge on caring for those who take care of us. This bill is the first of its kind in all of Canada. Well done to all of us. A healthcare plan for firefighters, long overdue. Let's change that today and support this bill.
Seeing no further speakers, the member for Langley Walnut Grove closes debate.
I close debate.
All right, there we go. Members, the question is third reading of the bill. Those in favor say aye. Aye. Those opposed say nay. Motion is carried.